Hello again. Welcome to my YouTube channel. I am Dr. Gerry H Tan. We continue to do my series of advocacies in terms of information regarding endocrine disorders. This time we will be sharing about the best diet for diabetes, and this is the third video of this series. We all know that when we talk about diabetes control, the pillar is plain and simple, an active physical lifestyle. And of course, a very important part is to determine what we eat. The problem is in our present scenario is we continue to have the lack of time to exercise, but we are guilty of the pleasures of too much food. So one way to address chronic diseases has been to do fasting or caloric restriction. Studies have shown that fasting or caloric restriction can actually improve insulin sensitivity in the liver, decrease fatty liver, and therefore reduces injury to our liver, which may result into cirrhosis. Furthermore, fasting and caloric restriction has been shown to actually be cardioprotective by way of its protection on the blood vessel wall. Because of its weight loss effect, fasting and caloric restriction has also been shown to improve insulin sensitivity in the fat cell. Furthermore, with fasting and caloric restriction, it has been shown in clinical studies to reverse diabetes because it can improve or reduce age-related decline of the pancreas. As well, it can improve blood glucose control because it has been shown to reduce insulin resistance in the muscle and improves the muscle uptake of glucose. So one way to practice fasting in clinical practice is the so-called intermittent fasting. So intermittent fasting is the practice of cutting down the number of meals rather than just cutting on calories. We have different ways to do intermittent fasting. We can do fasting for 2 days per week, or we can do it for 24 hours, 1 to 3 days per week. But what I always advocate to my patients as a meal pattern that you can sustain long term is the so-called time-restricted feeding, wherein you eat for 8 to 12 hours and fast for 12 to 16 hours. So in this time-restricted feeding, between meals and during the fasting periods, during the 16-hour fast, definitely since you don't eat, insulin levels drop and the body then resorts to fat as a source of fuel. By burning fat, it results in weight loss. In order for time-restricted feeding to work long-term, I want you to consider an easier form of intermittent fasting. The best effect is to eat earlier during the day, between 7 to 3 p.m., wherein during the 8-hour feeding window, your first meal is 7, your second meal usually I recommend a meal replacement, and the third meal should be before 3 p.m. However, you can adjust the time frame of your feeding window. You can also do it later, like 10 as your first meal. Your meal replacement is around 2 p.m. and you should not eat beyond 6 p.m. In order for this time-restricted feeding to be effective, plain and simple, avoid simple carbs, avoid simple sugars or baked goods during the feeding window. It is best that you focus on eating vegetables and lean protein sources. A tip is never snack between meals. And further tip, do not snack or eat at night Otherwise, you'll break the fast. So the bottom line is, in this meal pattern, always follow the meal plan that you can sustain for long term, depending on your day-to-day activity. But never forget to aim to exercise daily and move. This will make it healthier to do this intermittent fasting program. And remember that this time restricted feeding as a form of intermittent fasting is not a fad diet. Rather, that it's a lifestyle change. It has to be a lifestyle change that you can sustain long term. So if you like my videos, feel free to please subscribe and be notified, including click on the notification to be notified for new videos. Also try to click on the link beside for more videos, the previous videos that we had. At this point, I would like to thank again everyone for joining me. I hope to see you again in our future videos. With that, thank you very much.